Well, Dr. Alan Bernstein is the president and CEO of CFAR, a Canadian-based global research organization. You can see he's with me now. Dr. Bernstein, thanks for taking time to speak with me today.
My pleasure, Peter.
Look, we are starting to see the ramped up vaccination plans from the provinces now based on what you've seen and been hearing. How confident are you that provinces will be able to deliver on those plans to try and speed up these vaccinations?
Well, I think, now that the deliveries have increased, I think all eyes have moved from Ottawa to the provinces, and I'm confident that the provinces will iron out the bugs. It's a question of how quickly they'll do it, so that we get these vaccines as quickly as possible. And I think the great thing is Canadians really want these vaccines, and they want them sooner than later. So let's just hope that the provinces solve their problems. And every province is different. So it's hard to generalize in terms of what's going to happen.
Yeah, that may be part of the problem we're seeing early days here is the desire for those vaccines. We know Ontario will launch its online portal March 15th for booking appointments. Some people asking why it hasn't already been established. In Alberta, the online booking system crashed today on day one. And I guess I'm wondering, whether you think those problems are to be expected, or do they give you concern about just how well prepared the provinces actually are?
Well, I think it does reflect the high demand for these vaccines, and I think that's in one sense that's a good thing. On the other hand, it's important to get these into arms as soon as possible. A, so we're all protected, but B, so that we really limit the appearance or emergence of these variants of concern, that are these mutant viruses that are somewhat more transmissible, like the one out of the UK or the one out of South Africa that seems to be more resistant to the vaccines.
When you talk about variants, and it's really important as we follow this story to sort of talk a little bit about intersections. You have, the rate of infection, the number of cases dropping in the country, the number of variants going up, the vaccine rollout trying to take place as quickly as possible. And all of that makes me wonder which camp you're in here about a third wave, and whether that's going to be inevitable, or is there anything we can do to either seriously minimize it or prevent it?
Well, I think there is. I think there's two things we can do. One is, of course, to get these vaccines out as soon as possible. The second is, I think, to keep observing, even more so now, the sort of, I'll call them traditional, it's been a year, traditional public health measures of wearing masks, keeping our physical distancing, washing hands, and keeping a lockdown in place until we've nailed it. At the end of the day, I'm pretty confident that we're smarter than the virus, and we will beat the virus. But we'd like to do it with to minimize the effect on our economy and on our health as much as possible. And so I think we've just got to keep those two strategies in mind. And that's going to be key for the next few months. Right. So there's good news and bad news. The vaccines are here. They're coming in higher numbers. That's great. But so are the variants.
It's been interesting to hear the last couple of days, too, and more than that, I suppose, the magnitude of this process. And when we talk about resources and who's going to administer all these doses as they roll out to the provinces. And now we hear looking at pharmacies and doctors' offices, massage therapists, acupuncture clinics. What does that tell us about the need for speed in getting these vaccinations done?
Well, I think there is a great need for speed. People are getting ill every day. People are dying every day. And even though the numbers are going down, they're not down to zero. And there is a risk with the variants that they'll start to go back up again. And I think, look, there's a lot we can learn from how the UK has done the rollout. They have done it so well. We should really be looking closely, in my judgment, at what the UK did. They had a 24/7 operation with volunteers helping out. And I know from my own circle, just friends actually, when we've talked about this and they've asked me about it, every one of them has said they'd be willing to help in one way or the other if they were asked to, or if they had a way to do it. So I think provincial governments should draw on that resource and make this an all-out effort. It's the Brits are used to doing it based on what they did in World War II.
Right. I mean, have we heard enough about that in this country, about a sort of a call out to anybody who's available to help with even in some cases, doctors know exactly what to do, but other people could be trained up. Have we been hearing enough about that in this country?
No, I don't think we have. And I think there's also, it's not just injecting the needle, it's someone taking a record of your name, your health card number, and which vaccine you got, because soon we're going to have a number of different options of vaccines. There's the 2 RNA vaccines. The AstraZeneca vaccine apparently is going to be approved any day now by Health Canada. Johnson & Janssen just released the results of their vaccine today, this morning,
Yeah.
and those results look pretty good.
66% effective with a single dose. Yeah.
With a single dose, and if that's preventing serious disease, it's 94%. So I think we're going to see the J&J vaccine approved pretty soon as well. So we're going to have options, but it also means someone's got to keep records of which vaccine you've got.
Right. Let's finish on this. What about this? The idea of combining the doses of vaccines, which could speed up the vaccination process, at least for an initial dose to more people. Using one approved vaccine, then getting perhaps a different second approved vaccine for your second dose. Is that a realistic option?
Yeah, I think it is. But I think we need to do the experiment first. We need to actually find out whether mixing and matching, or what's called heterologous prime boost, coming in with one vaccine of one science platform, so an RNA vaccine first, let's say, and then the viral vector vaccine second, whether that actually gives a better immune response. And I think there's reason, sort of in theory, to think that actually will be the case, but we need to do the experiment. Now, again, there's an experiment just started in the UK to actually to ask that question. I think it would be wise for Canadian investigators to hook up with the UK's colleagues and do that trial here in Canada as well. And the trial is actually better done here, because to do the trial, you need people who are immunologically naive. That is, they've never been exposed to the virus. And so we're a much more immunologically naive population than in the UK. We've had much fewer cases of the virus here, and much fewer people vaccinated.
Yeah, so
it will be
a good place to test it. Yeah.
It's a really good place to test.
All right, Dr. Alan Bernstein, thank you so much for your time tonight. Appreciate it.
My pleasure.